So, today we'll begin a simple primary care review on chronic constipation in adults. Constipation is described as having less than 3 bowel movements a week, and or if they have become difficult to pass. Chronic constipation is considered as constipation lasting for several weeks or longer. Initial management. Patient education. Patient education involves increasing fluid and fiber intake, trying to defecate after meals, as this is particularly important in the morning when colonic motor activity is the highest, and tapering the overuse laxatives if used every day. Bulk forming laxatives, such as psyllium or methylcellulose, take diet fiber and bulk forming laxatives together with adequate fluids, as this can improve bowel habits in many patients with constipation. Fiber. High fiber cereal, citrus fruits, and legumes stimulates the growth of colonic flora. Wheat bran is one of the more effective fiber laxatives, but may aggravate bloating and abdominal pain in irritable bowel syndrome. The recommended amount of dietary fiber is 20 to 35 grams per day. Laxatives. Surfactants. Stool softeners such as colace are intended to lower the surface tension of stool, therefore allowing water to enter the stool more easily. Osmotic agents. Polyethylene glycol and saline laxatives cause intestinal water secretion and increase stool frequency. Lactulose, also known as enulose, is a synthetic disaccharide. Lactulose requires some time to achieve its effect, usually 24 to 48 hours. Sorbitol is an equally effective and less expensive alternative. Saline laxatives such as milk of magnesia, magnesium citrate, or magnesium sulfate may help, and hypermagnesemia may be seen primarily in patients with renal failure. Stimulant laxatives. Stimulant laxatives such as bisacodyl, senna, or dulcolax drops can cause the alteration of electrolyte transport by the intestinal mucosa, which increases intestinal motor activity. Management of severe constipation. Suppositories. For treatment of defecatory dysfunction, such as glycerin or bisacodyl. Disimpaction. For patients with a fecal impaction. Mineral oil, which starts with manual fragmentation, then an enema with mineral oil will help to soften the stool and provide lubrication. Thank you.